Welcome. If this is your first session to the Bariatric Support Group, then welcome. The idea is that on the first Wednesday of every month, except for January, you can join these Zoom sessions, and there'll be different people from the Salford team, and sometimes our other Bariatric team joins as well in the Northeast, and we just give you a good idea of a feel for us as a team, a feel for the surgeons, what goes on, and we have different topics. So hopefully it'll be super useful for you, especially with delays in bariatric services. It's a really useful way to make sure you're not feeling lost while you're in limbo, and that you've got some way of catching up with us and hearing the latest on things. So don't be offended if some of your questions, so any questions you have, put in the Q&A chat, and we'll come to those at the end of the session. But don't be offended if we don't answer all of them. We'll try and answer the questions around the topic and speakers. So for tonight, we're talking about pharmaceuticals in a way. So it's everything to do with kind of medications and supplements after surgery. So we have Raeesa Tailor, who's an integral part of our team. She's our bariatric whiz when it comes to all things medications, and regularly gets lots of questions from our team. So we're really grateful to have her here tonight. We also have Joanna Lenner. She works for Fit For Me, which is a private provider of the supplements you take after surgery. And I'll tell you a little bit more about that before Joanna speaks. And also, for those of you who don't know or may have spoken to Shirley, so Shirley is our bariatric care coordinator at Salford. So she's going to be joining the pre and post-op support groups in the future as well. You may notice we haven't got our ABL friends today. That's fine, and hopefully I'll be able to run the show okay, and bear with me. So I'll not leave you waiting any longer and hand over to Raeesa. Thank you.
Thank you, Jodie. So hi everyone, my name is Raeesa, and like Jodie has mentioned, the purpose of this presentation is just to give a bit of an overview about the role of the pharmacist and in their responsibility in taking care of the bariatric patient. So the things I'm hoping to cover in the presentation is just a bit of talk about pharmacokinetics, the different types of bariatric surgery and the resulting changes to the anatomy, the impact that will have on the medications, some of the factors that we need to consider as a result of that, a little bit about supplementation, and just what you would expect to see to be discharged with when you undergo surgery, and then finally get the opportunity for questions. So what happens to medications after you take them? So very simply put, this is a study of pharmacokinetics. So it's exactly what the drug does to the body. So when you take medications, it undergoes numerous processes within the bodies in 4 stages. So absorption, so it's absorbed. So there's different sites of absorption within the body. And the stomach is one of the primary sites of absorption, as is the small intestine. So after absorption, the target is the bloodstream. So after it gets within the circulatory system, and it then gets distributed within the body to the different parts, to the different organs and where it needs to go for its site of action. It then undergoes metabolism, and the liver is the most common place where this will occur. And then finally, the medication is excreted from the body. So all drugs will undergo these phases and will have different pharmacokinetics. So a sleeve gastrectomy, so the picture on the left is what would be the resulting anatomy after you've undergone a sleeve gastrectomy. So what that results in is a loss of absorption site of the stomach. But what's important is that with the sleeve gastrectomy, you do retain all of the small intestine. With a gastric bypass, the resulting anatomy results in much smaller stomach size, and the absorption is significantly reduced, and it will bypass the duodenum completely, which is part of the small intestine. So what these resulting anatomical and physiological changes means that the stomach size is going to be drastically reduced. So this means that the primary area for disintegration, so when you take tablets orally, you need to give it time for it to disintegrate. And quite often, in order for it to disintegrate and then, get absorbed and get into your bloodstream, that happens in your stomach. So after surgery, we need to consider that the stomach size has decreased. The other big change is the fact that the pH within the pouch that's created after the surgery is much higher than that's found in a normal stomach. And then the surface area is also reduced within the GI tract. So there's less surface area for the drug to be absorbed in after surgery. What impact will that have on the medications? So with the stomach size being reduced, there's restricted size, and therefore you're not going to get, there's a chance of not the medication not being completely disintegrated. With the increase in the pH, a lot of medications are soluble and in an acidic environment, so they rely on the acidic pH noted within the stomach. Some medications are absorbed and are soluble in an alkaline environment, which means that they will be absorbed in the small intestine, but that's bypassed in a gastric bypass. So that's against these things we just need to consider with medications. And finally, drugs which require longer transit times to undergo their absorption are likely to have impaired absorption because we're going to have a reduced surface area for them to work with as well. So what are some of the things that we need to consider, and what recommendations do we normally make with the medications? So the first big one is that immediate release formulations are preferred. So any medications that have an MR or an XL next to them means that they have a modified release or an extended release, meaning that they are given much longer time for it to release its content as it goes slowly throughout the GI tract. So we avoid these types of medications after the surgery. Any enteric coated, so like GR resistant, again, can also be quite problematic because this means that it's absorbed a lot further down, and in patients post bariatric surgery, there's much less GI transit to work with. So we try and avoid these kind of medications as well. Effervescent formulations, so sometimes just in the immediate kind of post-op period, due to discomfort, effervescent drug formulations are best avoided. So we want to make sure that the tablet is fully dissolved and allowed to settle before drinking. So we also monitor the patient. So we're really lucky in that a lot of the medications after surgery, we should be able to monitor to make sure that they are still quite effective. So for example, if you're on a tablet for hypertension, for high blood pressure, and you take that medication, in order for us to see that it's still being absorbed and it's still being effective, we can just keep an eye on the blood pressure. Similarly, for if you're on medication for pain, for heart rate, all sorts of things, normally if we just want to see that it still produces the intended effect after surgery. So we won't necessarily make all changes. We'll sometimes, quite often, just make sure that we kind of keep an eye on it and monitor it. The other thing to consider is that the openings after the surgery are very small. So about 1 to 1.5 centimeter wide for things for intake to pass through. So we just need to bear that in mind because certain medications are bigger than 1 to 1.5 centimeters, and so those medications will need to be changed. So the alternative drug delivery routes that we want to consider would be liquid formulation. So if absorption is reduced, a liquid preparation or an alternative administration route may resolve the problem. So you can consider crushing tablets when appropriate, but so that's an option. We can open up the capsules and dissolve the contents in water. In practice, we don't often always switch all medications to liquid formulations, and that's because we're trying to avoid dumping syndrome. So if we give, especially in the kind of acute period after the surgery, if we give a lot of liquids, that can be quite uncomfortable for the patient. So in medications where we have to take liquid, we try and aim for sugar-free liquids, and we advise to sip slowly. There's other routes of administration, such as patches or subcut medications if needs be, but these are, again, it all depends on what medication you're already off, and they'll get a thorough review and only switched if needed. So I thought I'd talk just a little bit about the nutritional deficiency. So bariatric surgery impacts both oral intake and absorption, which puts you at increased risk of nutritional deficiencies. So there's a chance of because of the fact that you're not going to be able to take as much orally, there's a chance that you're going to be prone to fat soluble vitamin deficiency, so vitamin A, D, E, and K, calcium, iron, vitamin B12, and folate. So following all our bariatric procedures, we normally recommend that you get started on a multivitamin and mineral supplement. So the minerals are quite important. So these contain the thiamine, minimal amount of iron, zinc, copper, and selenium. If you've undergone a sleeve gastrectomy or Roux-en-Y, we also recommend taking additional iron on top of what's already included in the multivitamin and vitamin B12 as well. So the reason that you need vitamin B12 is that there's a protein called the intrinsic factor, which is produced in the stomach. And as a result of after the surgery with the reduced stomach size or the bypassing of the stomach, it's going to have an impact because it's needed in the body's role to absorb vitamin B12. So if you're not able to have as much of that intrinsic factor, you won't be able to have as much vitamin B12 because you won't absorb it. Which is why we also recommend that you have every 3 months an IM injection of vitamin B12 to ensure that you don't become deficient. You will also, if alongside this, obviously this will provide, it won't be treatment doses of vitamins, it won't be treatment doses of the minerals. So if you are found to have any deficiencies, it is important that we treat the deficiencies. The post-op medications that you'll get started on. So this is a list of the post-op medications that you'll get started on. So the first one is a blood thinning injection. So surgery puts you at risk of developing a blood clot in the veins. So as a result of that, we always send patients home with a blood thinning injection. The dose that you will have and how long you'll have depends on it depends on you. So it depends on your risk factors beforehand. It depends on various things. So it'll be patient specific, those two, how long you take it for and what strength you take. The second thing that we always send patients home with, and we want to be mindful, is something to manage their pain after the surgery. So quite often it would be liquid paracetamol and codeine tablets. But this is somebody that, for example, wouldn't have been on any medications to manage their pain or doesn't have any comorbidities or conditions that requires them to take anti-inflammatories or any kind of medication, pain management medications before the surgery. The third type of medication you'll be started on are lansoprazole. So that's different centers use different PPIs. So what PPIs stand for are proton pump inhibitors. So because of the new joining that's made after the surgery, there's a chance that ulcers can form at that new joining. So to prevent that and to reduce the acid in the stomach, we start patients on proton pump inhibitors, and that reduces the acid in the stomach. So we tend to give lansoprazole dissolvable tablets, 30 milligrams twice a day, which we advise to take for 6 months. And then after that, you can reduce it to just once a day. Different centers will advise different things. This is what we currently use. So this is in the kind of post-op immediate period. After that, you will be started normally 2 to 4 weeks. You'll be seen by the dietitian, and you'll be seen by the specialist bariatric nurse, and you'll be started on, or that's when you will be started on the oral vitamin and mineral supplements for life. So that was my quick presentation on just medications and our role.
Brilliant. That was great and really informative. There's been some really good questions coming through. So we're going to come to the questions in a minute. But with the next, we'll go to Joanna. So do you understand when you have a bariatric surgery, that's a sleeve or bypass surgery, our team will recommend to your GP the medications and supplements we would like you to have afterwards. And it's very much a prophylactic, so a preventative measure of you becoming deficient, because you simply won't get everything you need from diet alone. And supplements are normally introduced one by one, so you can see that they agree with you. And as I do my follow-up with you, and our medics also do follow-up with you, and our dietitians, if you're having problems tolerating any of the supplements, there's lots of different alternatives out there. But sometimes that additional cocktail of supplements a day can be a bit too much for people. Sometimes people really struggle swallowing tablets. So I've invited Joanna, who works for Fit for Me, who's a private provider of everything that we would want people to have after surgery. So we're regulated, and we know exactly what we'd like to have. And there are other companies out there. Joanna has kindly joined us this evening just to tell us a little bit about the alternatives for if you prefer to do this, or if you're struggling with the things that the NHS provide. Okay.
Yeah, thank you. I'm going to share my screen. You see it?
Yeah.
Just going to close this. Now, thank you for giving me this time to speak a little bit about bariatric supplements. I'm Joanna Lenner, and I'm a bariatric dietitian from Sweden. You might hear that. And I work for Fit for Me, and we do bariatric supplements after weight loss surgery. In the past, I worked for Bariatric, that's all Nordic company that also do bariatric supplements, but we were acquired last year by Fit for Me. So now we are transferring to become Fit for Me. So that's what I'm going to talk about today. And I know before surgery, most patients are afraid of the surgery itself. Am I going to survive, or what will happen? But as a dietitian, I'm more worried about the time after. How will you manage to take your supplements? Because we know from science that that's one of the hardest things to do, to be adherent to your supplement, because probably you'll feel better than ever, and you think that you eat well and get everything you need, and maybe your blood values are great in the beginning, but you're also going to have great values for the rest of your life, and then you need your supplements. So that's my biggest worry about this. And as mentioned before, both after sleeve and bypass, you need supplements, and that's both sleeve and bypass are the most common surgeries in the world at the moment. And you need it because you have decreased gastric acid, and you need that to dissolve vitamins and minerals and to absorb them. You're eating less than before, and you don't have as good storage as before because you have them before surgery, but then you lose them over time. So you need to fill up with vitamin and minerals. And you're also eating less and maybe select different types of food. So that's also a reason why you need supplements after bariatric surgery. And Fit for Me, it's world market leader in supplements after bariatric surgery. What's really strong about this product is that it's scientifically proven. We have today 15 studies behind the products, and we are doing 2 more now at the moment. So we have a lot of science behind the product, because normally, as mentioned before, we have several different pills on the market, and we can combine them in different ways. But that was before the bariatric supplement was founded. So I think you should take a bariatric supplement if you are undergoing bariatric surgery, because that's adapt for your anatomy and your needs after surgery. And our products, they are also tailor-made to each type of operation. So if you have had a bypass, you have a certain product, and if you have done a sleeve, you have a different product. I will show you later. And we also offer personal support. So when you call our customer service, you get the possibility to speak to a dietitian. And that's also something that's good in the long run when you might not belong to your like bariatric clinic anymore. So that's like a safety net. And when how do you buy Fit for Me then? You go into our website, fitforme.com/UK, and you choose your type of surgery. And we have one supplement for gastric sleeve, one for gastric bypass, one for mini gastric bypass or OHGB, and one for pancreatic diversion or duodenal switch. So these surgeries are doing different things to your body, and that's also why you don't need exactly the same amount of vitamins and minerals. Here are the different types of supplements. Either you choose the Optimum, that's for gastric sleeve, Forte for bypass, gastric Primo for OAGB, and Maximum for BPD or DS. So first choice is type of surgery, and then you can choose between chewables or capsules. So in this example, if you choose gastric sleeve on your website, you have to choose between chewables or capsules. And the product that we recommend is the capsules, because it's just 1 pill a day, and the capsule contains everything you need except calcium. So except buying all those things that you do at the pharmacy, you can only take this little capsule and calcium on the side, and then it's done. The capsule is also very good because you can open it and there's a little powder inside it if you have problems in the beginning to swallow a capsule. It's also very easy to swallow because it's coming down quite easily. But it's also possible to open it. You can also, what was I going to say? I lost it. If you don't prefer the capsule, you can take chewables instead. We have chewables, as you can see on the picture here in the middle. But if you take the chewables, we have iron on the side. Otherwise, in the capsule, you have iron in it. But if you take the chewables, you will have a little pill of iron on the side. And that's because it's not that nice to chew iron. It doesn't taste good and it's not good for your teeth. So capsule is the first option, but if you don't like to swallow pills, you can choose the chewable. The good thing here is also, I talked a little bit about bariatric supplements, and the capsule and the chewable is dissolved quite easily in your mouth or in your little bowel. If you take other pills from the market, they are like hard pressured pills and they're not made for this environment that you have in your stomach after surgery. So choose the capsule or the chewable, and then you'll add calcium on the side. And the good thing here is that you can choose the model that suits you, because I know price is an issue. Some people want to spend money on this because I really, really care about my health and I want the best. And some people feel that, oh, I maybe not afford this. This is too expensive for me. And then we have another option. So the first option is the basic product. And here is the example with the sleeve option, but it's the same price, even if you have done a bypass or a DS or whatever. But if you choose the basic product, it's 0.66 pounds a day. So that's not that much, but then you have to go to the pharmacy and buy calcium there on the side because you also need your calcium. And if you want to go for our product or calcium, it's the support option, and that's 1 pound a day. And this calcium is like a little candy thing, a chewable that's very, very tasty. It tastes lemon. I have it on my office and I have to like, I don't know what to say, but I have to really, really not eat too much of it because you're not supposed to have too much calcium either. But we have this in lemon flavor and also raspberry that will come soon. But that's the support option. And if you feel that you need even more calcium, you can buy the support plus, and then it's 131 per day. And then you have 2 calcium a day, and it's 1,000 milligrams. So it's quite flexible, and you will have it on a subscription model. So you can't buy it in the pharmacy or in any store in the UK. You have to order it online. And the good thing with this is that you get it to your home every 3rd month. You can pause whenever you like, and you can cancel whenever you like, but we're going to call you because we're going to make sure that you are taking something, because we are dietitians and we care about that you will feel well after surgery, even if you're not our customer anymore. So every 3rd month you get a delivery, and that's also good because then you probably will not forget about it, because that's quite easy otherwise when you have to go and buy it yourself or get a prescription from your GP. So that's a good thing, I would say. And how can I move on from this then? We have sample box, and they are really good, I would say. For only £5 a day, you will get multivitamins, depending on surgery method, which one you choose. So you will get for 14 days the capsules, and you will get samples of chewables as well. You will get calcium soft chew to try, and also protein powder. And then when you have tried it, you'll get a telephone consultation with a dietitian. So if you would like to try, this is like low-hanging fruit. You don't have to create a subscription or anything. This is just like a good start if you want to be prepared, or if you already have something that you're not that happy with. So maybe take a picture of this nice picture to get the QR code. Otherwise, it's fitforme.com/UK/sample box. So this is a good option if you're curious to see what this is and to try it out. Yeah, and we also have an app. I'm actually the founder of it, together with one of my former colleagues who is a doctor. And we created this app because we wanted to make life easier after bariatric surgery for our patients. The app is available today in 6 languages, and it's for free. So you can download it now, use the QR code, and you can track your progress. You get support of your healthy routines, and you can be inspired by others that have had VLS. We have recipes in it made by dietitians for like soft food and liquid food and normal food. You can add your measurements and your weight curve. And yeah, there's a lot of things going on in there. So I really think you should have it. And a good thing also is that you track your vitamins every day. So you will push a button that's orange, and then you'll get a message. And this could be the message. I hope you can hear her voice here.
Hi, it's Emma from London. I am a 1-year post-op patient. If you are seeing this message from me, that means that you're using your Bariatric app to log your vitamins and track your process.
Yeah, that was a sneak peek from the app. Sometimes you get a message from another patient. Sometimes you just get a text message, well done. And if you're not pressing the vitamin button before the evening, you will get a reminder. So that's a good thing, because we know from science that less pills, better adherence, and a reminder is also good for the adherence. So order a sample pack and download BariBuddy app. That's my 2 recommendations from today. So why Fit for Me then? Yeah, as I said in the beginning, it's scientifically proven bariatric vitamins, and it's actually adapt for your anatomy after bariatric surgery. And it's also tailor-made to each type of operation, because you should get exactly the amount of vitamins and minerals you need after your type of surgery. We have a subscription model that's make it easy. You get home delivery, you don't have to think about it. And we also have dietitian support in customer service, because I hear a lot from patients that after a few years, they feel quite lonely because they have questions, they need someone to talk to, but maybe they can't contact their like bariatric clinic anymore. So this is a good thing that you can always call us and book an appointment with one of our dietitians that can support you even in the long run. Great, thank you for this. Hope to see you soon, and that you'll become customers, of course. Otherwise, good luck with your vitamins.
Oh, thanks so much, Joanna. So, yeah, thank you, everybody. So just to clarify, when you have bariatric surgery with the NHS, we will ask your GP to prescribe the supplements that we want you to have lifelong. The GP only have so many things in their formula that they can give you. And presently, it would usually consist of 1 iron tablet, 2 vitamin D and calcium chewable tablets, then it would be 1 quite large multivitamin, and B12 injections that you would arrange with your practice nurse every 3 months. The GP in the UK, they do not have to prescribe multivitamins, so it's not guaranteed that you would get the forcible. So there is unfortunately always potentially a cost with this surgery after, especially if you pay for your own prescriptions and if your GP won't prescribe multivitamins for you. They tend to prescribe the iron and the calcium and the vitamin D, but for some reason the multivitamin is one in their formula they don't necessarily have to give. For the majority of our patients, that's not an issue. And for the majority of our patients, they can usually tolerate what the GP is able to give them. There are a few different alternatives we can try through the GP, but it's useful to know what options are out there, because what if you have this surgery and you're struggling and you would prefer to have maybe an easier way to have it, so 1 tablet a day or some chewable tablets to go along, and a chewable tablet maybe a lot more feasible for some people. It's sad and it's a harsh reality of our system. The NHS won't prescribe whatever we want. They will only prescribe what's in their formulary that the government are happy to have to pay for. So, Joanna, I really appreciate you giving up your time for us from all the way from Sweden. And also, was it Switzerland? Good. Yes, I do really appreciate that. And she's also for our post-op support group, she's generously going to give us some sample packs, so when we start doing our face-to-face sessions at the end of the year, people can also get those samples there as well as getting them on the website. So it's a good idea. I think there was one thing I just must clarify. It was a £5 discount voucher that was with that sample pack, not that it's £5 a day. And from following the exact kind of formulary that we would want the GP to give you, I think for Joanna's company, and it's very competitive, they're pretty much all the same in these private providers, it works out around £1 a day. So yeah, about £30 a month. Okay, just to clarify some of the questions that were coming through. But I appreciate you need to get off, so thank you so much.
Thank you for this.
Thank you, Joanna.
Thank you.
Okay.
Good luck.
Okay. Take care now. So Raeesa, let's go over to the Q&A. There's been some good questions. Quite a few of them were asking, I take a lot of tablets already. Can I still have surgery? Is this going to be a problem for me?
No, it's not going to be a problem for you. So whether you are accepted for surgery, that is a decision. I mean, correct me if I'm wrong, Jodie, but the surgeon makes that ultimate decision, don't they?
So when you come along to meet us at the appointment, you'll definitely always see the surgeon, or most cases we'll also see the medic, and they'll go through your individual history, the medications you're already taking, and then usually because you've gone through your tier 3 weight management, it's very unlikely at that stage you'd be told, oh no, you're not really suitable. You should be suitable when you're accepted to come over for surgery, but we'll make you aware of all the risk, and if there's any additional risk because of your preconditions, you may also meet our anaesthetist as well. So there's so when you're taking lots and lots of tablets, we'll go through them as directly after surgery. You're on a weaning diet, so it may be that we're just going to tailor those. But I'm probably answering the question for Raeesa now, so I'll let you take over.
It's fine. No, it's like Jodie said. So it's just if you're on a lot of medication, it's just more work for us to think about and make sure that they are still all appropriate for you after surgery. And it's just more considerations that we need to make, and we'll go through them all individually. So no medication that you would be a contraindication for you to undergo the surgery.
So there was another question around HRT patches. Can those still be used?
Yes. During wait, sorry, just to clarify, is this after the surgery or after the surgery?
No, good question, because before surgery, sometimes you may have to come off them because they can have a slightly blood thinning effect, and we want to make sure your clotting factors are great for healing after surgery. But no, after surgery.
Yeah, so like Jodie said, they can put you at an increased risk of developing a clot. So because of the fact that you're already undergoing surgery, there may be a time where we would advise before the surgery, especially, that you come off these patches. But after the surgery, you should be fine. The altered, after surgery, the altered anatomy would have no impact, and the patch would probably be a more suitable option for you than taking the oral tablets.
And the same question about progesterone tablets. Is that something they can still take after surgery?
Yes. So it depends what you're taking the progesterone tablets for. Progesterone doesn't have the clotting risk, so it would be fine to take before the surgery. But if you are taking it for contraception, then we would advise after surgery to take something that's non-oral, because there's a chance that you may have impaired absorption if you take it orally.
Yeah. And there's a few questions around pain relief. So ibuprofen, can you take this regularly after surgery?
No. So we recommend, because of the new joining and because of the new altered anatomy, there's an increased risk, obviously, with anti-inflammatories, and in all patients there's a risk of it irritating the stomach lining. Now, obviously, with patients that after surgery, when you've got that altered anatomy, it's going to put you at an increased further risk as well, and there's very high risk of complications. So we tell patients to avoid taking all anti-inflammatory medications after surgery.
Brilliant. And I mean, you will get guidance from the team. So after surgery, I will be ringing you, checking you're happy with what you're taking and so on. And we do have people where they may have, I don't know, maybe they've developed an abscess. They need to get in with the dentist. They've got to wait. Absolutely, taking ibuprofen. It's really effective pain relief. But it's something that you're taking as a one-off for that experience. So in those instances, it's okay, but it's not something you should be taking regularly. So bear with me, I'm just going through. There's a few questions about injections. That is a whole other topic. It's still quite new. So when we start talking about tiered services or levels, I've seen a few people say that. So what happens when you go to your GP and you're saying, I'm struggling with my weight, and they say, right, we'll refer you for weight management. Weight management services are also known as tier 3 services, and in that level of expertise they'll be able to look at medical weight management for you as well. So this could include some tablets, it could include injections. Injections have very strict criteria, so this is something that all of you who are attending tonight should be in weight management, a tier 3 weight management. So if this is something you're thinking about to find out if you're eligible, your individual practitioners will know about that. They'll be able to look at that for you. They've made it quite difficult. I think hopefully it will get easier for us to give it to more people, but at the moment the kind of restrictions on who they can prescribe them to and who they can't is quite strict, but we are hoping as time goes on that will ease up a little bit. Saxenda is the main drug that everybody's heard of, and yes, there was a national shortage, and yes, it was on the news, and then they tell the health professionals afterwards that supplies are coming back in. I don't think it's back to the level where everybody's going to get it straight away again, but yeah, it's definitely a tool at our disposal that can be very effective, and as I say, only tier 3 weight management specialists can provide these. Your GP can't. Us as a bariatric surgical service, which is known as a tier 4 service, we can use them very sparingly for very extreme cases, but again, it's always your weight management. So it's tier 3 that you're in at the moment, the weight management program that you're in, whether it's ABL, Salford, More Life, the different ones across the country. So you do need to redirect that question to them when you have your next appointment. SWMS is Salford Weight Management Service, and that is also a weight management service where you can ask about Saxenda as well. Okay, let's see what other questions. I'm on warfarin. How will that affect me? So for people who don't know what warfarin is, this is a blood thinning medication. It's most likely been given to you because you either have a heart condition or you've had a blood clot in the past.
So if you're on warfarin, we normally have a plan for that. So it depends on the reason why you're on warfarin in the first place. So the common reasons are either you're currently treating a blood clot, you've had a previous blood clot, or you have a heart condition called atrial fibrillation where your heart rate's too quick, and that puts you at increased risk of developing blood clots. So depending on why you're on it, that will impact. So what we would always say is we would stop your warfarin 4 to 5 days normally before the surgery, and that's to make sure that because patients that are on warfarin, we want their blood to be thinner than what your blood normally would be. So to try and get back to baseline, because obviously we don't want to put you at increased bleeding risk, we make sure we stop warfarin so we get as much warfarin out of your system and it's not there anymore in your body. Depending on your risk, so if you are defined as high risk, and if you're categorized as that, for example, if you've had a previous clot in the previous 6 months to your due surgery, then we would give you something to cover for that, to make sure that you do have something probably like an injection to make sure that you are anticoagulated suitably in preparation for your surgery. And then after your surgery, when the surgeon deems suitable, you'll be restarted on your warfarin and everything will be back to as normal. And the great thing about warfarin is that obviously we'll just keep an eye on your INR and we'll make sure that it's in the target range and we can adjust it. So that's good.
Brilliant, thank you. So a few other people have come in with medications that they take for their heart. They're asking about things like rivaroxaban, clopidogrel. So would you briefly just be able to tell us a little bit about what they might expect to do with those around surgery?
So again, it kind of depends on the reasons why you're on it in the first place. So clopidogrel, if you're on, that's the only blood thinner that you're on, and because you've had a previous stroke or you're at increased risk of stroke, that in itself isn't such a high indication. So we would normally just stop it about 7 days before the surgery, and again just restart it when the surgeon deems suitable. We wouldn't really do anything apart from that. With rivaroxaban, that's a slightly that's again another blood thinner that's relatively new. It's been here for about 6-7 years now, but rivaroxaban, the way that it works is that it's absorbed in the stomach. You have to take it with your food to ensure that it is absorbed properly, and so it can take effect and produce the intended effect that it's supposed to in your body, which is to thin your blood. So quite often, again, depending on the reasons behind it, we review it. We wouldn't recommend it after surgery, and we would provide you with a suitable alternative.
Okay, brilliant. There was a few questions about the size of tablets that people take. and modified release preparations, which I think you explained really well in your presentation. So I know that very often when you come in on the day of surgery, our pharmacist will look at what you're on, and they'll let you know in that first 3 weeks, which is when you're on fluids only, which ones are essential medications that you're going to go home with. And the majority of those will be less than the size of a 5p piece, or there'll be preparations that can be taken in a liquid form or crushed and put on like a tiny bit of yogurt, or taken with a little bit of juice. And then after 3 weeks, when you've been really, really careful, we're like, well, we're really happy that that first stage of healing has happened. You can take everything you want now, but obviously we go nice and slow. So things like atorvastatin, they're pretty big tablets. So we'll be looking at that and seeing if you really need it, or if it's something you can wait and have, because if it's just for cholesterol, then we'll say, no, don't worry, you'll be fine. And then maybe reintroduce it. And there's certain things we hope that as you go through your weight loss journey, you might not need to take in the same way. So lots of people say, oh, I'm taking lots of tablets, or I'm a bit worried about this pain relief and so on. So really, until you go through your rapid weight loss, which usually starts to tail out around the 4 to 6 month stage, and then you go on to lose almost the same amount of weight or maybe a little bit less over the next 18 months, you plateau at those 2 years. And that is a real journey where you and your GP will get to know each other better, because there'll be certain medications you might not ever need again. So if you had high blood pressure because of your weight, and we'll soon know, because your blood pressure may come back to normal as you lose weight. And then if you take that medication, you then making a healthy blood pressure become low and you're feeling faint and dizzy, you need to come off those medications, or you need to have them tweaking. The same we found with chronic pain. It's such an interesting area. It's an area that I think got a lot of news attention not that long ago, where they're saying, yes, no doctor likes to listen to a patient in pain and not be able to help, and we tend to pull quite a lot of different types of pain relief onto that chronic pain. But now we're looking into it, is have those things had a benefit? And it's really interesting for me after surgery how many people have come off a lot of pain relief, and found different types of different ways to manage pain, or as I say, their gait and posture may be changing with their weight. Some of the pain could have been caused by wear and tear, and so there's a lot of topical things, so you can completely not use your GI tract. There's a lot of alternative therapies out there, hydropools, water therapies, physiotherapies. There's lots of kind of alternatives to just tablets as well. So it's a definite journey, and along the way, yes, we're here to support you, but you do need your GP, because they're kind of looking at you holistically, and as you're losing that weight, they should be super supportive, because they're going to be able to, because it's so heartbreaking when you are big and you sat before a healthcare professional, they're going, well, if you just lose weight, or oh, if you have to be this BMI to get that. It is quite soul destroying. So when you're on a weight loss journey, it's going to be quite exciting to see what other things that can be looked at as you go along the journey. Okay, right, I'm going to keep looking through to see if there's any more questions around medication. So Raeesa, talked about HRT. Bear with me, I'm scrolling through. So yeah, morphine and opiates, as they're known, are absolutely fine after surgery. And that includes tramadol. Some people are saying I take steroids. Will that be an issue after surgery?
So again, it kind of depends on the reason why you're taking the steroids. I suspect that it might be oral steroids. So no, they wouldn't impact you. You would slightly, because the fact that obviously you are on, depending on if you're on something for, if you're on steroids for rheumatoid arthritis, so you're on something like maintenance steroids, so you've been taking it for a really long time, that obviously causes immunosuppression within your body. So if that's the risk, then there is a slight risk, but we account for that. And we'll adjust your medications beforehand, and we'll adjust your medications afterwards as well, to make sure that we account for that. So again, it's not a contraindication for you having to undergo surgery or nothing like that. We'll just have to take further considerations.
Okay. Some people are saying that they take things like water tablets, frusemide and such. would they still take that straight after surgery?
So depending on what you are taking it for, like Jodie has already mentioned, because you're not going to have such a great, you're not going to be able to take much and tolerate much orally after the surgery, something like a diuretic, again, depending on why you're taking it. So if you're taking it for blood pressure, or if you're taking it because you get a bit of swelling around your ankles, we'll review that, we'll consider that, but quite often we'll probably stop it immediately after the surgery. And it might be something that in a couple of weeks it's reviewed, and we may restart it, or like Jodie has already mentioned, it might be something that with your GP you may decide to stop it altogether. Again, it depends on the reason, but because of the way that diuretics work, because you're not going to be managing much orally, there's a chance that it can obviously cause more complications and cause more harm than it can good at that point. So we normally stop it, and there's a chance that it can get restarted, or there's a chance that it can get stopped altogether.
Brilliant. And Raeesa, I think you're navigating my questions and the audience's questions really well, because these are very individual diagnosis that you have, and people will meet a medic on a one-to-one basis. So some of you could be on quite a cocktail of things that might affect something else that you're taking. So we do look at you as an individual. So the purpose of this evening is to give some generalized ideas about what might happen with medications. So we do have to be a little, not vague, but we can't say, oh, this will definitely happen and that will definitely happen, because you are an individual and your needs to be met, need to be met individually. So there was other things, like another question that came in about levothyroxine. Does that still get absorbed well after surgery?
So again, just to reiterate what Jodie's already said, I think everything I'm responding with is obviously, it depends on a personal situation. And the great thing is, like Jodie's already mentioned, medics and us as pharmacists will review your medications on an individual basis, and make the appropriate changes. So you can be reassured in that sense. Levothyroxine, great. The great thing about that is that we do check levels. So anybody that's on levothyroxine will know that annually they go get their blood tests done and check their T4 level to make sure that it's in range. So levothyroxine has a really long half-life. So if for a couple of days you were to miss it, it wouldn't really impact anything. We wouldn't recommend that you miss it anyway. But again, if you're worried about the way that it's going to be absorbed, there is a chance that you might need to increase your dose or decrease the dose, but we were going to be very much guided by your T4 levels. So that's something that will be not in the immediate post-op period. We'll probably continue on the same dose. I'm talking months after your surgery, where that may impact or may not impact. But the great thing is that you are going to be guided by your T4 level results.
And one thing you'll hear from me a lot after surgery is about spreading out medications so they don't interfere with your nutrition. And also certain things don't like iron. So the supplement iron doesn't absorb well with vitamin D and calcium. So we know
levothyroxine is what
calcium.
Levothyroxine is one of them as well.
Yeah, I was just going to say, so you'll find that the supplements that you take sometimes have to be separated out, and also certain medications, and levothyroxine being one of them, you need to leave at least half an hour between that and iron. So we talk that through again individually afterwards, because it can be a bit overwhelming. You're kind of changing habits of a lifetime, having to spread out medications, and that's probably a top tip I give you now. If you can sort of put your medications into maybe 3 bundles a day, as it were, that can be quite useful. And other things that Raeesa touched on in her talk that's quite interesting, things like modified release and slow release. It doesn't mean that you should never take them again. It's being aware, and your prescriber being aware, that you may not get the exact same effect after surgery. So sometimes as you lose weight, you don't need tablets, or they need reducing in dose, and other tablets might need increasing in dose for you to get that effect. So it is a bit of a balancing act after surgery, and it's something to be aware of. Antidepressants and antipsychotics as a group of medications, how do we feel about those?
So again, with antipsychotic medications, the ones that have like a narrow therapeutic range already require levels to be done in community if you're already on it. So again, we would just continue monitoring, checking that. depending on obviously how many medications we would always liaise with like the mental health consultants to make sure and ask for their input in the medications as well. But quite often we would continue. We would make sure that if, for example, if it was a modified release tablet, which sometimes some antidepressant medications are, in the post-op acute period, we would switch that to normal release. That may mean that you, from taking it just once a day, you might need to take it twice a day. But those are things that we will consider and change if needs be.
Brilliant. And we do class lots of medications that are to do with your mood and well-being, so things like sertraline and citalopram, as an essential medication, because you may have worked hard to get that balance and you know what's working well for you. So those tablets usually happily are quite small. So you can, so they don't get affected. You carry on taking those straight all the way through. So yeah, so I think after surgery, there might be a few things you go home with that might be new to you, and they could have wonderful tastes and textures, but it's only for the 3 weeks. So I would say power through unless they're making you feel sick or being sick. Other than that, then it's fine just to just realize it's only for that 3-week period, and then you can go back to what you were having before, and then we monitor it as you go along and tweak things with help of your GP or any specialist that you're under. And there's some things that we like to boast with bariatric surgery that could go into remission or even be cured, and that's things like type 2 diabetes, especially if you've recently been diagnosed with that within the last 5 years. We can see remission of that quite quickly, so you may never need medications for diabetes again, and you certainly won't be on them in the first 3 weeks after surgery, because the liquid diet, you just won't be getting the same amount of intake to raise your blood sugars anyway. And then things like conditions like obstructive sleep apnea that you use a CPAP machine for is a different kind of therapy. You may not need that in the same way after surgery, and hopefully you will be completely cured of obstructive sleep apnea. So there's lots of things to get excited about for longevity. There's lots of things we hope you dodge and you never need medications for, because of the amazing achievements that you in using this tool for weight loss. So I think we're almost there with the questions around medications. Just keep doing a last scroll through. There are a few questions around, there was some around epilepsy drugs. Again, you know, these are essential medications. We would want you to keep taking them. There's quite a few out there. So again, I would get rid of the anxiety that you cannot have surgery if you have epilepsy. That's not true. You can, and we will have a look at those for you and guide you after surgery with them as well.
Yeah, with those ones, like Jodie's already mentioned, there's lots of different formulations, that licensed formulations from the manufacturers, just because of the nature of medication that it is. So we've easily got soluble tablets, or we've got liquid medications of them.
Someone was asking, can you take things like paracetamol and Gaviscon? And yeah, you're not, for the majority of medications, other than that group of non-steroidals, those naproxens, ibuprofens, which are the most common ones that you get, that can cause very specific risk to the actual little new stomach that you have. No one wants a stomach ulcer. You certainly don't want a stomach ulcer in a very small tummy. So it's trying to mitigate risk, and that goes along with other things. They're not just those kind of drugs. We know that the risk can massively increase in smokers. So very often people will be told, oh, you need to stop smoking for surgery, and lots of people think that's because of general anaesthetic. And the anaesthetist wants you to have a really good airway for surgery, so they don't want you smoking up to surgery. It's not the case for bariatric surgery. You might think we're just trying to make you the uber healthiest people on the planet. You're going to be non-smokers, you won't enjoy alcohol as much anymore, and you're going to be losing weight. But kind of joking aside, it is really important that you're not just a non-smoker, but you're a non-smoker for life. So I often ask in one of my follow-ups, you know, are you smoking? And people are like, oh, I'm a non-smoker, and I'm saying, well, keep it that way for the rest of your life, simply because that increase of risk of forming ulcers, narrowing strictures, things that compromise nutrition are threefold in that of a smoker, and our surgeons simply won't do surgeries on smokers because they do not want you to have that risk. So that's something else to think about. So if you are a smoker at the moment, think about all the different alternatives out there. We don't advocate vapes. We know that vapes have just become a new terror in our community. We know that there's lots of science to suggest they're better than smoking. I'm not really here to debate that. But we have said that if people are using vapes to come off cigarettes, fantastic. You can do that, and then you can actually find that you can get 0% nicotine vapes, and that's what we would ask you to try and get onto, and then hopefully be smoke or I don't know what you call it, cloud free. Let's see if there's any others there. Okay, there's a few things maybe for your tier 3. So for example, your weight management service may be looking at things like the Saxendas or the orlistats. That's not, those things are completely contraindicated once you've had bariatric surgery, because you simply do not need those things anymore. Just scrolling through. Oh, someone's just saying they've recently been diagnosed with fibromyalgia. There can be different medications. Very commonly, they're things like gabapentin. I think is probably a common one that sometimes you might try with fibromyalgia. These are things that can and can't help. Fibromyalgia is a bit of a nasty one because you get flare-ups of it, and taking a daily tablet may not help with that. So it's again quite individual, and you can take these medications after surgery. We know that there's medications out there that are appetite stimulants. So when people say, "Oh, I'm taking a drug that's weight gaining," it's a little bit of a misconception. There are no drugs that create fat, so you don't swallow a drug and it create fat in your body. But there are drugs that increase our appetite so that you don't feel satisfied, and that's a horrible feeling. We all know what it feels like every time we try and do a diet, and you get those kind of like I'm starving feelings. So it's just having the self-awareness around that. So if you're having a weight loss surgery, that initially will help you not feel as hungry, which is great, but then you're taking a medication that enhances appetite. It's being aware of it. So if you're say taking certain medications, maybe quetiapine or something like this, it can make you more munchy, but by then you'll hopefully know what those dedicated snacks are that you can go to that won't necessarily compromise the good work you're doing. We don't like to think about diet after bariatric surgery as in you're on a diet, because you're not. You're just making new habits for a whole lifetime. So go-to snacks are a definite, and they might be things you need, especially if those medications that do increase appetite are actually of a greater benefit for you to be on than not be on at all. So they again are not something you can't take after surgery, but your level of self-awareness will be there. Okay. Oh, this is an interesting one. Someone was just saying, what if I'm needle phobic? Because after bariatric surgery, there's a little tiny hair-like needle, and however tiny hair-like it is, that doesn't really make someone with needle phobia feel relieved. So we tend to give a preventative measure of tinzaparin or enoxaparin or clexane. They're all like tiny little injections that ever slightly thin your blood, along with some very nice stockings that will ask you to wear for 2 weeks day and night after your surgery. So Raeesa, do we think of alternatives to that, or do we give tips of what they can do instead if they're really struggling, or we just let them shut their eyes and someone who really wants to stab them?
Unfortunately, it is the last option.
Yeah.
Because we have to make sure that it definitely works in your body and goes straight into your bloodstream, especially because of, there's a chance that oral ones wouldn't get absorbed properly. It has to be the injections. So yeah, close your eyes and get somebody else.
Yeah, I think it's a really tricky one with phobias, and they're, joking aside, these things can be quite severe. So if you know that you've got some phobias, there's different ways you can address those, and unfortunately waiting times for surgery are long. So these are things that you can start thinking about and addressing now. So yeah, absolutely. So I won't keep you any longer, Raeesa. You're more than welcome to leave now. You've been fantastic. The session has been recorded. Stevie and Abby from ABL will be putting the links in the Facebook group that's there, and they'll put the links in the next session when they're back next month as well for you all. So thank you so much, Raeesa.
No worries. Thank you very much.
Thank you, Raeesa. Nice to meet you.
Nice to meet you too.
We will end the session shortly, but I know there was a few questions around waiting times. As I say, unfortunately, there is just not a big enough provision of bariatric surgery in the UK for everybody that's entitled to it, which means waiting lists are lengthy. It's not just COVID related, it's a national issue. So at the moment, the weight management service you are in, you usually complete around 6 to 12 months. You go along to your sessions, they have a team meeting with you, and at some point they'll say to you, great, let's refer you for bariatric surgery. Then the referral gets received, it goes through a funding check, and then it ends up on a waiting list to come and meet our team. And that can take, at the moment, 66 weeks from that referral point to meeting our surgeons. When you come to meet our team, we have two options at the moment. This can change, but at the moment we have two options for where people can have surgery. So the Salford Hospital or your other hospital, it's the one in the northeast, Castle Hill. That hospital is the main NHS centre. So these are the ones with the A&Es, the ICUs, and the whole wealth of everything. So we do find that the bariatric surgical lists, they often can either get cancelled or they don't have the same availability as what we would love. So we prioritise our Salford lists for patients that can only really have surgery in our centre. So this would be a patient that perhaps is on dialysis and would need that extra care afterwards. Maybe they have multiple significant comorbidities. A comorbidity might be something like stroke, heart disease, and so on. So for the patients that need that extra monitoring and the extra expertise of other specialities, we will ask them to have their surgery at Salford. We try and use private hospitals with NHS contracts who take NHS contracts, and at the moment the Oaklands Hospital across the road from Salford, they have our team of surgeons operate there. They have a lovely anaesthetist as well, so it's our team using their facilities, and they do private and NHS work, so their teams are experienced with bariatric surgeries. However, they do stipulate their own criteria. It's a BMI criteria, as well as as what I just explained around comorbidities. So for gentlemen, it's a BMI of 50 and below, and for ladies, it's a BMI of 55 and below. So that's just something to be aware of as well. And the reason I tell you this is because when you come to meet us, there may be a few more things that need to happen. It may be that you need a sleep study to look for obstructive sleep apnea. It may be that you'll have a psychological assessment, and most people do, because bariatric surgery is very much body and mind. And there can be delays for that, so it could be sort of 3 to 5 months until those things are done, and then you'll be offered your surgery date after your pre-op assessment, either at the Oaklands, and if it's at Salford, that tends to be more around, from meeting the team to being offered that surgery, does tend to be more around a year. So they are long waits. So potentially, if this is your very first meeting and you've just started with your weight management / tier 3 weight management service, it could be up to 3 years until you're actually looking at a surgical date. And it's really important that you have that, because managing expectations on mental health and everything else is really important, and it can feel frustrating when you're experiencing delays, and that's why I think it's really important when I do these sessions that I let you know everything I know, so you can be as informed as possible. Okay then, everyone. I know there's been a little bit of upset in the chat. I always have mixed feelings about the chat. I like it when we're doing our talks that people are listening, and sometimes when you're chatting it can be a bit difficult. I know that there can be contrary opinions on things, so yeah, apologies if I can tell from some of the chat there's been a little bit of an upset. It doesn't happen all the time. People are people. And it's okay to have different opinions, but at the same time I think it is courteous to hear the speakers out, because they're giving up their time for you tonight, and it's really great that we have so many people attend these sessions. So I hope you found it useful, and thanks again to everybody.
Take care,
Just
everyone.
yeah, take care. The next session we'll advertise what it's on. I'm just trying to think now. Oh, it's the dietitian, Salford Chris, our Salford dietitian, is going to be leading the session in November. Trying to think what we've got going on in October. I think it's one of our surgeons is speaking in October. I think it's Professor Senapati. And then at Christmas we'll have a patient experience and a bit of a quiz. Okay, then, so that the information about all those next sessions will be provided for you, and I look forward to seeing you again.